Inside every man over 60, there is a silent alarm system. It's not a device of metal and wires. It's a network of nerves and delicate blood vessels, connecting your heart, your brain, and the most private parts of your body. For decades, this system has been quiet. But as we age, it starts sending signals. These signals don't come with a flashing light or a loud siren. They arrive in quiet moments, a change in firmness that you try to ignore, a new, unfamiliar discomfort during a moment of private pleasure, a feeling that something is off. Most men dismiss this. They call it getting old and close the door on the conversation. I am here today as a urologist with over 2 decades of experience to tell you that is a dangerous mistake. Those feelings are not just the quiet whispers of aging. They are vital health data. They are the first tripwires in your body's silent alarm system, and they are often trying to warn you about much bigger issues with your heart, your circulation, your prostate, long before any other symptom appears. A patient, we'll call him Robert, came to me thinking he was broken. He wasn't broken. He was simply the first person to finally hear his body's alarm. Today, we are going to teach you how to listen to yours. We will talk about how to navigate your sexual health safely and confidently after 60. And most importantly, we will teach you to decode these signals so you can tell the difference between a normal change and a critical warning. This isn't a taboo topic. This is your health dashboard. Let's learn how to read it. As our bodies change, our practices must adapt. This isn't about limitation. It's about being smart and kind to your body. I call it the 5 pillars of safe self-pleasure. The first pillar is mindset and self-compassion. Before anything else, you must give yourself permission. Generations of men were raised with guilt around this topic. We dismantle that now. This is a normal, healthy biological function, an act of self-care. Approach it with an attitude of health and kindness. You are exploring your body as it is today, not as it was 30 years ago. Let go of the pressure to perform. This is for you. The second pillar is the right environment and superior lubrication. This is non-negotiable. As we age, penile skin becomes thinner and more prone to micro tears. Aggressive, dry friction is a recipe for pain and infection. You need a high-quality, body-safe lubricant. Do not use household lotions or soaps. They can contain perfumes and chemicals that disrupt pH balance and cause severe irritation. Your choices are water-based, which are clean but can dry out, or silicone-based, which are incredibly slick and long-lasting, perfect for sensitive skin. Consider lubricant an essential piece of health equipment. The third pillar is technique, the marathon, not the sprint. The old goal of reaching climax as quickly as possible is now counterproductive. Reframe the experience. Slow down. Your nerves may be less sensitive. This is normal. Rushing only causes frustration and irritation. Embrace the journey and vary your touch. Don't just repeat the same motion. Explore with different pressures. Use your fingertips and open palm. Rediscover your own body. Pay attention to the glands, the frenulum on the underside, the perineum, the testicles. The mind is also a critical component here. A relaxed, imaginative state of mind is just as important as physical touch for arousal. The fourth pillar is the importance of hygiene. This is your best defense against common issues like UTIs or balanitis, an inflammation of the head of the penis. First, always wash your hands beforehand. Second, cleanse gently with warm water afterwards. If you are uncircumcised, it is crucial to gently retract the foreskin and clean underneath to prevent bacterial buildup. Pat the area dry with a clean towel. And third, urinate after climax. This simple act flushes the urethra and dramatically reduces the risk of infection. The fifth and most important pillar is listen to your body's feedback. Pain is not something to be ignored or pushed through. It is a clear and direct signal. If you feel any sharp pain, burning, or significant discomfort, stop immediately. Your body is telling you that something is wrong. It could be simple, like a need for more lubricant. Or it could be one of the critical red flags we're about to discuss. Now we cover the other side of the coin. When your body is sending up a flare, a red flag, these signs should prompt you to make an appointment with your doctor. Seeking help is a sign of profound strength. Red flag number 1. Persistent pain. Fleeting discomfort is one thing. Persistent pain is another. Pain during erection or ejaculation could signal prostatitis. Testicular pain should never be ignored. A deep, aching pain in your pelvis could relate to a chronic pelvic pain syndrome. Pain is your body's alarm system. Find out what's causing it. Red flag number 2. Significant erectile dysfunction. It's normal for erections to be less firm with age, but a consistent inability to achieve or maintain an erection is ED. Think of this as your body's check engine light for your heart. The arteries in the penis are only 1 to 2 millimeters wide. The coronary arteries of the heart are 3 to 4 millimeters wide. A blockage or disease will almost always show up in the smaller vessel first. Your ED could be the earliest warning sign of heart disease, hypertension, or diabetes. Red flag number 3. Changes in ejaculation. Pay attention here. Blood in the semen, called hematospermia, while often benign, can in rare cases signal infection or prostate cancer and always warrants a diagnosis. Painful ejaculation often points to prostate inflammation. A sudden dramatic drop in fluid volume could also be a sign of prostate issues or hormonal changes. Red flag number 4. Physical lumps, bumps, or sores. Get familiar with your own anatomy. Gently check for any new hard spots on your testicles. Look for any sores or unusual growths on the penis, and feel for any new curvature or hardened areas along the shaft of the penis when erect. This could be Peyronie's disease, where a plaque, which feels like a flat lump or a band of hard tissue, causes a painful bend. Most of these things are benign, but early detection of those that aren't is everything. Red flag number 5. Accompanying urinary symptoms. Your urinary and reproductive systems are neighbors. A problem in one often affects the other. If sexual changes are paired with a weak or slow urine stream, difficulty starting, a frequent need to go, especially at night, or a feeling of not emptying your bladder, this is a clear signal to get your prostate checked. And red flag number 6. Overwhelming psychological distress. If this part of your life is causing you significant anxiety, guilt, or depression, or if it has spiraled into a compulsion you cannot control, that is a health issue. Your mental well-being is not separate from your physical well-being. Speaking with a therapist is a sign of strength. Remember Robert? When he returned, we had a diagnosis. We had a plan. We had adjusted a medication and given him the knowledge you have now. He looked at me and said, "Doc, I realized it wasn't about performance. It was about listening." This conversation is about listening to your body with wisdom and respect. It's about decoding your silent alarm system to preserve your health. It is not taboo. It is healthcare. It is a conversation about living fully and with strength at every stage of life. Thank you for having it with me today.